So that brings us to this research that's forcing us to go through a major reevaluation. Because these researchers from Harvard and McLean Hospital conducted a case series following 8 patients who all met the full diagnostic criteria for NPD. These were not just people with a few narcissistic traits. These were individuals with a full-blown clinically diagnosed disorder. And the patients then went through a long-term psychotherapy program, including psychodynamic therapy and mentalization-based treatment for about between 2.5 to 5 years. And the results stunned the researchers. At the end of the treatment, all 8 patients had improved so much that they no longer met the diagnostic criteria for NPD. This is what the researchers called remission. Their ability to work, go to school, maintain healthy romantic relationships had also dramatically improved. Before treatment, most struggled to hold down a job or a healthy partnership, but by the end, they were financially independent and in stable relationships. So, if remission is possible, what does that brutal multi-year journey look like? Let's be clear, it's not a simple fix. It is a grueling long-term commitment to intensive psychotherapy, self-examination, and self-awareness, with daily, moment-by-moment insight, practice, and response. So some of the approaches they used in the research were transference-focused therapy to uncover deep-seated beliefs in the NPD person. This type of therapy helps them confront the painful ideas from their childhood and replaces them with healthier ones. Another approach they used was called mentalization-based treatment, and this therapy helps people learn to mentalize, to see themselves from the outside and others from the inside. In other words, it helps them build empathy by teaching them to recognize and care about the inner worlds of other people.